All right, y'all. In this video, we'll be going over hip internal rotation PAILs rails from a 90-90 position. Most people won't need anything. Some of you may need blocks as a prop to help you either maintain or get into the position. So I'm going to be targeting my right leg for internal rotation. My knees are going to drop to the left, right? My right leg comes back, and I'm looking for a 90-degree angle at knee and ankle. If it's not perfect, that's a-okay, right? Quad and femur is coming out straight to my side, right? And to target this leg with this hip in internal rotation, what we're going to do is we're going to dip the pelvis back so that floating glute goes towards the ground. All right, for some of you, that may be enough right off the bat. If you have more space, what you can do is take this hand and your torso and rotate towards that leg. For some of you, this may be enough. All right. If you have space and you want to deepen it, you can continue to rotate, lean, torso, lateral flexion towards that ankle, and also lean back a little bit. And finding that vector, whatever works for you, everyone's physiology is going to be a little different, of rotation, lean, lean, until you feel a good stretch or a good capsular stretch in that internally rotated hip. Now, as far as the blocks go, if this is an uncomfortable position for you, you're tight in the shoulders, you may get some sensation down the arms, what you can do is just grab those blocks and prop your hands up. For some people, they really enjoy using the props to kind of maintain this position more comfortably. For those who are really stuck, quick note, if you place that block underneath the externally rotated hip, underneath the pelvis, it kind of creates some space to where you can target this to a higher degree, especially for those who are super, super tight in the adductors, or if you don't have a lot of abduction, right? So I'm going to hang on to the props. I'm going to drop my pelvis. I'm going to rotate and lean until I feel a good capsular stretch. PAILs rails in this position is rotating at the hip, isometrically ramping up from 10% to 100% safest max effort so that my hip joint is rotating and my foot is getting heavier into the ground, not pressing down into the ground so that my knee is coming along for the ride. The knee stays there and the foot rotates and drives into the ground through external rotation of the hip, right? So isometric ramping, again, PAILs rails, we maintain this passive stretch position for 1 to 2 minutes, ideally 2 minutes. Try not to be lazy, right? And then isometrically ramping 10%, 20%, 100% safest max effort, driving through the hip, the foot into the ground, swinging it through the earth, through the ground. Maintain that 100% safest max effort for 3, 2, 1, flip. 100% effort internally rotating the hip to try and get the foot off the ground, the opposite direction, holding that for 15 seconds, maintaining that for 3, 2, 1, relaxing and leaning a little more. Now, when you go from PAILs to rails and you flip it up, try not to drive the pelvis forward. Maintain that pelvis down towards the ground, and all you're doing is contracting the tissue to try and get the foot off the ground through internal rotation. Now, if you're in a position and you go from PAILs to rails and your rails looks like this, or worse, this, you're not in your end range position. Really try and find that end range so that when you rails it, nothing moves, but you're squeezing as hard as you can to try and get that foot off the ground. Again, when you go from PAILs to rails, don't do this and don't do this. All right?